Hi everyone, I'm Dr. Elizabeth. I am your pelvic health physical therapist and owner of Tidal Physical Therapy. And I wanted to make this video because a lot of questions that I get revolve around simply what is pelvic health physical therapy? What do I need to know about this? What do you do during an appointment? So I wanted to be able to answer those questions. So I like to give the caveat that as physical therapists, when we graduate our program, we graduate really with the opportunity of going into any field of physical therapy. So this could be working with sports and athletes, maybe going into pediatrics and working with kids. Some will go into like a hospital setting or an assisted living setting. So there's a multitude of areas where us physical therapists can really integrate into the medical system. I chose pelvic health physical therapy, one, because I really love the idea of creating harmony and allowing people to get back to their daily routines, such as toileting, eating, intimacy without any pain or dysfunction or sensitivities. So I really felt like this was the calling for me, so I chose to go down this route. So what is pelvic floor or pelvic health physical therapy? So this is a really specialized niche in which us physical therapists really hone into the region right around our abdomen, our pelvis, our hips, and the pelvic floor muscles in between. So this really encompasses issues such as constipation, hernias, bladder urgency or frequency, or urinary leaking. It might also include and does include pelvic pain, either with intimacy, maybe it's tailbone pain with riding a bike. It could be a lot of heightened nerve sensitivity, which could be a gamut of different issues there. So we as pelvic health physical therapists really hone in on identifying and working to resolve issues within this area of the body. I have my model here, so I wanted to give you a little bit of an up-close idea of the area that I look at. This here is the female pelvis. These two vertebrae here are our low back vertebrae. So really the curve of our low backs here, and then we have our buttocks back here. But the pelvic floor muscles are the muscles between our legs that really make up the whole bottom half of us. So I look specifically at this area. I go in and I feel and observe how well these muscles move. They are muscles just like any other part of our body. So muscles really need to be able to have full range of motion. They need to be able to be strong. They need to be able to be relaxed when necessary. And all of that creates a lot of harmony so that we could go to the bathroom without issue. We could be intimate without any problems, and we could ride a bike without any pain. So understanding how this area of the body works really does play into a multitude of dysfunctions and resolutions that you're looking for to get out of those dysfunctions. So us as pelvic floor PTs, pelvic health PTs, we really hone in on this area of the body. A question I get often is, does this require internal work? Do you do stuff inside? Is it all outside work? What does that look like? So as a pelvic health physical therapist, I choose to do both external stuff around the area as well as internal, whether it's intravaginal or intrarectal, to more directly affect what's going on at the pelvic floor. So there can be, with myself or a pelvic health physical therapist near you, the component of internal work. However, full consent, I'm always looking for you guys to make sure that you're okay with me doing that part of the assessment and or treatment, but it's always, the ball is always in your court, so that I hope to never feel that you feel pressured about doing that part. But it can be extremely beneficial at times, so if warranted, know that that can be a possibility for your treatment. But this is pelvic health physical therapy in a nutshell. I'll go over more in-depth ideas of what I look at as a physical therapist, but I hope this gave you an opportunity to learn a bit more. And if you have any questions, please reach out. Thank you. Bye.